Hello everyone. Today we are going to discuss a cyst fluid cytology. So here, the cysts are lesions containing fluid which are lined by an uh, epithelium. Cysts without a lining epitheliums are called pseudocysts. Right? So here, cyst we can divide into two types. One is true cyst and pseudocyst. So how to differentiate these two? The cyst, which is lined with epithelium, we call cyst. Without lining of the epithelium, we call pseudocyst. So aspiration of this cyst can yield diagnostic information. So when we analyze this cyst of aspiration, when we take fine needle aspirations or lesions, we can go through this. We can get very good information about the cyst. So as aspirate of the cyst fluid containing abundant fluid and the low cellular yield. So here when we consider the cyst, it's mostly contain the fluid parts and very low number of cellular yield, right? So when we consider the specimen should be, so the we know the fluid part is higher and the cellular part is lower. So after aspiration, a specimen should be centrifuged before make the smear. Otherwise, we will miss the cellular part because the cell numbers are very lower. So So cyst may be found in any part of the body, from skin to internal organ. So the aspiration can be done as a diagnosis procedure or as a therapeutic procedure to drain the fluid. So the commonly encountered cysts are normally we can see in skin, epidermal dermocyst. Other one is the salivary gland. Again, we can see epidermal cyst or benign or malignant cyst. Liver and pancreas, ovary, breast, and pseudocyst of the thyroid. The area where we can see the cyst, right? So let's move into the cyst fluid cytology. So, since the cell of the cyst fluid undergo degenerative changes which give rise to features that are similar to atypical cells, interpretation of these should be done after careful examination. So, the problem is the cell degenerative changes. So we know cellularity is very low. So sometimes the cells, normal cells, they can undergo the degenerative changes. So it's look like atypical cases, right? Atypical cells mean these cells are not the typical cells. There are some changes inside the cell cytoplasm or nucleus, nuclear membrane, cytoplasmic membrane, nucleolus, nucleoli, chromatin, and serratia. So if you can see, even in normal cells also undergoing degenerative changes, so it may lead to a misdiagnosis. So very carefully we have to examine these cyst fluid. So cyst aspiration done as first is uh, diagnostic procedure and therapeutic procedure to drain the fluid. So when we consider the cell types in cyst fluids, for first one is the macrophage. These are usually found in large number. Their cytoplasm contain material similar to the content of cyst. Example, mucin in macrophage is seen in mucinous cyst. So hemosiderin insists with hemorrhage. So here what they are saying, first cell is the macrophage inside the cyst. So this is when we consider other cells. So macrophage is a very high number. Normally cysts contain low cellular compound. So among the cellular compound, macrophage is the larger number, right? So and when we consider the macrophage according to the cyst type, it's also similar to macrophage. If it is mucinous cyst, so macrophage contain mucin, right? If it is hemorrhagic cyst, so sometimes we can send the hemosiderin, right? Right? So next one, type of cell types in the cyst fluid. One is the inflammatory cell. It's depending on the nature of the cyst, various types of inflammatory cells can be seen. For example, an infected cyst will have numerous neutrophils, and a parasitic cyst will have many eosinophils. So, according to the uh, cyst inflammatory type, so the inflammatory cells contain different, right? Suppose if you consider the cyst which is uh, uh, the infected bacterial infection, what happened? You can see neutrophil content. Suppose the cyst is infected parasitic cyst, it's contain eosinophil. At the same time, sometimes viral cyst, it contain lymphocytes. Right here you can see according to the inflammation, the inflammatory cell may be either neutrophil or eosinophil or lymphocytes. So when we these two are normally present, but atypical cell means this is due to the cancer, right? So atypical cells will be seen in neoplasmic cells. For example, cyst adenocarcinoma. Here you can see cirrhosis cyst adenocarcinoma. So example, so here complex papillary architecture and malignant cells in the glandular pattern and nuclear atypia and high mitotic activity, stratification and stromal inverse. You can see here. So these are about the cyst cytology. Now we will move into joint fluid cytology. So joint fluid cytology, first one is synovial fluid. So synovial fluid is formed by ultrafiltration of the plasma admixed with synovial cells, which line the joint cavities and the connective tissue mucin. So it provides nutrition to the joint and acts as a lubricant. So the amount of synovial fluid in the joint is very little, and increased amount can be seen in various diseases. So normally what the synovial fluid is very low amount, but in disease conditions the volume of the synovial fluid may vary. It is usually clear when we consider the synovial fluid. It is clear, straw colored and thick, and must be heparinized for cytological examination to prevent the clot. So it's like a filtration of plasma. No? So if you take it out, it will clot it. So to prevent this, we have to collect it heparinase anticoagulant. Also, we have to add uh, heparin. And when we consider the normal morphology of the synovial fluid, this is clear. There is no anything so very transparent, clear, and normally it is yellow colors and very thick. So, so examination of synovial fluid is essential for the diagnosis of infection or non-infective inflammatory disease of the joint and tumor. So normally why we examine this for the sometimes we already discussed the due to various diseases we can observe large amount of synovial fluid. If you observe like that, we have to take the synovial fluid aspiration and we have to diagnose the this is due to the infection or due to non-infection or due to tumor. The cytology of the joint fluid is diagnostically important as it is not frequently biopsied and aspiration is carried out for many inflammatory conditions of the joint. So here the cytology, joint fluid cytology is very important because we cannot take the biopsy. So normally what we have to aspirate the synovial fluid and we have to test or diagnose or observe for any reason why the problem in synovial fluid. So we already discussed this because so biopsies we cannot take, but only we can take aspiration first, and we have to analyze whether uh, what is the cause for the abnormalities in synovial fluid. Right. Now we will look at the cell type. So normal, what are the normal cells? Synovial cells we can see first. Synovial cells resemble reactive mesothelial cells. It is look like a mesothelial cells, right? And with round to oval nuclei. There now when we consider the nuclei, this is round to oval shape, right? And when we consider the chromatin, it is fine chromatin and cytoplasm is abundant. They are usually low in number in synovial fluid specimen. So synovial cells are the normal cell which is present in normal synovial fluid. So if you suspected any disease or any problem in the synovial area, right? So your joints actually, so you have to take the synovial fluid and you have to check if it is normal, even you can see in the synovial cells, right? But if it is abnormal, you can see somewhat larger number or something different, right? So you can see the picture here, abundant cytoplasm. When we consider the nuclei, this is round or oval shape, and normally it is present in low number because we already discussed synovial fluids are uh, high content of fluids and low cellularity. So when we consider the cytoplasm, this is abundant. So second one is inflammatory cells. So inflammatory cells are normally low in number and consist of histiocytes, mature lymphocytes, and occasionally neutrophils. So in the case of synovial fluid, you can see it's also present in lower number. What are the cell types? Inflammatory cell types. Histiocyte you can see the aroma picture you can see that is histiocytes. Mature lymphocytes you can see and neutrophils sometimes occasionally eosinophils also very rare. Neutrophil and eosinophil this depending on the neutrophil actually depending on bacterial infection, eosinophil depending on the parasitical infection or allergy. So when we consider the histiocytes have a round. So now we will discuss, goes through one by one the inflammatory cell. First one is histiocytes. So histiocytes have a round or oval kidney shape vascular nuclei. So the picture is very clearly indicating the histiocytes. So only when you consider the nuclei, so it may be round or oval kidney shape and often enlarged nucleoli. So you can see nucleoli here. This is the nucleoli, this area, right? This area you can observe nucleoli, right? And increased histiocytes are seen in rheumatoid arthritis, systematic lupus erythematosus, and tuberculosis. So you can see in inflammatory cells, suppose due to the disease condition, right? So when we consider the neutrophil, so normally neutrophils are usually a few in number, and it is increased number you can see in septic arthritis, right? So normal cell, what is the normal cell? Synovial cells, but sometimes due to the inflammation, so you can see inflammatory cells. It's depend on the infection, right? Next one is lymphocytes. Lymphocytes are also few in number, and increased number can be seen in rheumatoid arthritis, collagen vascular disease, and chronic infection. Right. So next one is the next inflammatory cell is eosinophil. Eosinophils are rare and increased number can be seen in parasitic infection and malignant effusion. So these two are the conditions where the eosinophil number is high. So other abnormal cells present in uh, synovial fluid is atypical abnormal cells. So atypical cells, these cells can be seen in neoplasm of the joint, right? In previous cases, uh, actually, when you consider about joint fluid, so synovial fluid, so normal cell you can see, and some problem may happen due to an infection, the inflammatory condition, or due to the neoplasm. So we can, if the joint is affected by the inflammation, so we already discussed different type of cells we can see, but actually the neoplasm to identify we can see different cells, right? So you have to clear about that. So atypical cells are mainly seen in neoplasm of the joints, right? So when we consider the synovial fluid, so it is during the neoplasm, right? So it is cloudy, thicker or thinner than the normal fluid. So normally when we consider compare with normal and abnormal one, normally the synovial cloudy and sometimes it may thick or thinner compare with normal one, right? Or sometimes when we consider the fluid fluidity. So this is made due to crystals or excess white blood cells or microorganism in the fluid. So these are the main three reasons for cloudiness of the synovial fluid. So when we consider the crystals inside the synovial fluid, this is normally not present. So if the crystals are present, it's confirmed neoplasm of the joints. And other main, actually the main crystal is urate crystals. This is due to it actually can be seen in the pseudo. Right here, the summary of the cell seen in the synovial fluid. Neutrophil, yes, you can see the morphology of the neutrophil is polymorphonuclear leukocytes. The significant mainly indicate the sepsis inflammation. So during this inflammation, more than 80% of the cells are neutrophil. So this is due to bacterial arthritis, gouty arthritis, rheumatoid arthritis. So these three conditions we can see the large number of neutrophils. So next cell is uh, lymphocytes. So this is mononuclear leukocytes. So this is indicate the non-septic inflammation. So this is not bacterial infection. This is due to a viral infection or the rheumatoid arthritis in which lymphocytes may be seen. Right, next one is eosinophil. This also leukocyte, bilayered, binucleated leukocyte. So these also increase uh, number more than 2% due to metastatic carcinoma in the synovial. Right, other one is the acute rheumatic fever. So during the acute rheumatic fever, you can see eosinophil high number, and rheumatoid arthritis also you can see eosinophil. So from this slide we can conclude rheumatoid arthritis you can see neutrophil, lymphocyte, and eosinophil concentration, right? And when we consider the macrophage, so this is single nucleus. So this is larger mononuclear leukocyte may be vacuolated. Some sign we can say vacuolation inside the cytoplasm. So this is normally present, right? Because synovial fluid, sometimes if bacteria or unwanted cells or materials goes to the fluid, so macrophage is the cells we call histiocytes. They can destroy that. So normally it is present. Or if the high number we can see in viral infection. So synovial lining cells, this is similar to macrophage but may be multinucleated, right? But in macrophage, histiocytes are the mononucleated, but in here synovial lining cells, this is similar, look like macrophage, but it's contained multinucleated. So if you observe any multinucleated cells like mono macrophages, so you cannot conclude this is due to neoplasm. No, because synovial lining cell is present, it is multinucleated, right? So it is also normally you can see inside the synovial cells or synovial specimen. Early cells, here neutrophil containing characteristic ingestion round body. So this is due to lupus erythematosus. So the early cells due to lupus erythematosus. Right here you can see that here larger cells it is which is contain neutrophil right inside the cells. The other one is the theta cells. This is vacuolated macrophage ingested neutrophil. So this is also macrophage but which is ingested the neutrophil. Right. So the clinical condition significant is Reiter syndrome. Other one is a non-specific inflammation. When it is occur, you can see these type of cells. So these are the references for synovial fluid, cyst fluids and urine cytology.